PRP for hair loss and vampire facelift timing. I'm interested in PRP treatment both for hair loss and as a part of the vampire facelift. Are there any concerns regarding the timing? Can they usually be done on the same day or a certain number of days apart?
Thank you for your question. You've submitted a question where you're asking if it is safe to use PRP for its application in the vampire facelift and for its application for hair loss at the same time. And so I think I can certainly give you some guidance with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon. I'm also the founder of Tricostem Hair Regeneration Systems, developed for non-surgical alternative for a hair transplant using platelet-rich plasma as a critically important component to this treatment. And we treat patients from around the world for hair loss with our system. In addition, I have been a member of the Vampire Facelift network and have been very vocal about its application and have been known for this treatment as well. So I'm going to first begin by just defining what platelet-rich plasma is and what it does, and then how it's used in vampire facelift and in hair loss. So to begin with, platelet-rich plasma is PRP is a concentration of the wound healing factors that are in your blood. So it is essentially taking the part of the blood that we need for whenever we get a cut and there's a little scab that formed and then eventually the skin heals over. This is due to cells called platelets and the healing factors that stimulate collagen and blood supply to heal. When we use platelet-rich plasma in other areas, it does the same thing without the wound having to be initiated. So we place it in the skin on the face to help stimulate skin quality and improve the glow of the skin. We use it in scars. We use it in when we do laser procedures. We use it a lot. So in a vampire facelift, it's defined by the use of a single syringe of a hyaluronic acid filler, such as Juvederm and Restylane, which is placed strategically in small amounts in areas such as the brow, the outer tail of the brow, the cheekbone area, the outer corner of the mouth, and to the point where you basically use one syringe of hyaluronic acid filler and then use PRP or platelet-rich plasma strategically in the skin so that you get this combination benefit of not only the improvement in skin quality, but there has been a documented synergy between hyaluronic acid and platelet-rich plasma in terms of benefit of long-term ingrowth of what's called fibrovascular tissue. Now in hair loss, as it is currently practiced, PRP is used as a way to help stimulate hair growth. And so routinely patients go to a doctor every month to get platelet-rich plasma injections into the scalp to try to stimulate hair growth, to try to combat the ongoing progression of hair loss. In our practice, we've developed a method called hair regeneration, where we use platelet-rich plasma combined with a material called extracellular matrix. In contrast to the monthly treatment with PRP, we actually typically do one treatment. Sometimes we'll do a second treatment into the second year. But this combination that we've developed and the method which is customized, and that's been the basis for our company, Tricostem Hair Regeneration, we're actually able to stop the progression of hair loss in male and female pattern hair loss and reverse this thinning process and get hair to become thicker. So our patients, as has been often mentioned, come to us from around the world. People are actually applying for visas to come for this treatment. But it is not in any way an issue if someone to use platelet-rich plasma in other areas concurrently with our hair loss treatment. In fact, it is very common for us, and as a surgeon, I will do procedures such as upper and lower eyelid cosmetic surgery and do the hair loss treatment at the same time, or upper and lower eyelid surgery, facelift, and the hair loss treatment, or combine it any number of ways. But it is no problem to do platelet-rich plasma in more than one area in the face and body, and be concerned of maybe a diminished effect or somehow some type of interaction. It's extremely safe, and it's been a remarkable tool in our practice in helping our patients reach their goals. So I hope that was helpful. I wish you the best of luck, and thank you for your question.